I myself, Dr. Mohanty, Professor, Department of Pharmacology, the Pharmaceutical College, Borpali. Today, my topic is anti-aarhythmic drugs, Quinidine. Before starting the anti-aarhythmic drug Quinidine, first I am discussing about what do you mean by arrhythmia. Arrhythmia, or we can say dysarrhythmia, means an abnormal or irregular heartbeat. It occurs due to abnormality in the side of origin of impulse rate or conductions. Anti-arrhythmic drugs used to prevent or treat irregularities of cardiac rhythm. Next come to quinidine. Quinidine is obtained from cinchona. That it is the dextroisomer of the antimalarial alkaloid quinidine found in the cinchona bark. What is the mechanism of quinidine? It inhibits the phase 0 depolarization, so that's why impulse generation that will not be conductor generation and conduction will be inhibited due to inhibiting of phase 0 depolarization. Next come to pharmacokinetics, well absorbed orally, highly bound to plasma protein, metabolized in liver, then 20% excreted unchanged in urine, usually given as slow release formulation, IM painful, IV marked hypotension. Then come to drug interaction. Quinidine increase the plasma level of digoxin because it displaces the digoxin from protein binding, displaced from tissue binding or protein binding site displaced by the quinidine. Digoxin decrease digoxin renal clearance, marked fall in BP in patient receiving vasodilators, risk of Trotsky's D point is increased by hypokalemia caused by potassium diuretics. Then come to adverse effect. That is adverse effect of quinidine is thrombocytopenia, sudden cardiac arrest. Then Trotsky's D points, that is idiosyncratic angioedema, that is genetically determined abnormal reactivity swelling. Then clinical use, it is used in atrial flutter and atrial fibro, that is rapid atrial pulsation. Then atrial flutter, it returns the rhythm back to the normal sinus rhythm, used in the treatment of ventricular arrhythmia. Next, then we will discuss next class. We will discuss about other class of anti-arrhythmic drugs. Thank you.